Hi everybody, Judy Seeger here, back with the Ozone Therapy Summit with Dr. Karen Bravo. Thank you so much for being on here today.
My pleasure.
Yeah, so we are doing all kinds of fun stuff down here in her clinic office, and we've been already going through some of the therapies and stuff, which you guys will be seeing. It's really awesome, but we also want to get into some more details about what Dr. Bravo does and the whole ozone therapy experience that she has. So first off, why did you get into ozone therapy?
Well, I want to help heal people. I want people to realize what they can do to help themselves. And it's all about getting the body to heal, and that means looking at the body on a cellular level and helping with different tests and with certain assessments, what's keeping the patient from getting well. And everybody is a different mixture of genetic predisposition and environmental pollutants and sometimes psychological factors, actually often. And everybody is an individual, and so everybody has an individual formula or pathway to wellness, and ozone is a huge part of that.
So when you got into it, were you just attracted to that type of therapy, or what was it that pulled you for the ozone?
Well, I've always wanted to help people get well. I've always had it in my nature to help others, and it's just my nature to want to help others. I've always been like that. I hope that's why most doctors get into medicine, whatever field they choose, because they're trying to help people. And there's a lot of different ways to help people, but I've always liked to go the natural route, and I've been very inspired by different mentors and seeing what they do and incorporating what they do into the realm of what I'm doing. So I've ascribed to different teachers like Robert Rowan and Howard Robbins, and on and on and on. And so, you incorporate, you learn, and you try to evolve and bring whatever's necessary to each patient. But
So how long have you been doing the ozone therapy?
I'm doing it about 2.5, 3 years now.
Okay,
3
great.
years.
So let's go down to basics for those who don't know what ozone therapy is. I want to ask every single person on the summit, what, in your words, is ozone therapy?
Ozone therapy is medical grade oxygen, and we take it and we put it through a special machine and we turn it into something called O3. It's an O2 with an extra molecule of oxygen, and that is a very reactive molecule, and it does a number of things. It doesn't do just one thing, and that's what makes it so magical. If there was one thing I could keep in the practice, if I had to give up everything else, I would keep the ozone, because the ozone, it helps the body realize more oxygen. It helps the red blood cells release oxygen to the tissues. There's a special enzyme involved with that is very inactive, particularly in diabetics. It helps open up capillaries. It lets red blood cells fit down those little tiny passageway capillaries to get into the areas of the body to release oxygen. And once the body has oxygen, it will make energy. And once the body has energy and nutrients, it will endeavor to heal itself. It just needs the energy to do it. The ozone works on the little energy furnaces in all of the cells called mitochondria. And they are instrumental in wellness because the body generates its energy. It makes its cellular money. And when it has the money to do things, it will carry out the functions it needs to. It will take in nutrients. It will take out the trash. I mean, imagine if you had a city that couldn't pay its bills. It can't pay its utilities. It can't take out the trash. Life would be very difficult to do normal everyday activities. So the ozone helps the body generate energy and carry out all of its functions. And so it eventually will help the body get back to all the backed work that it has to do. Did I mention that ozone is directly toxic to microorganisms, viruses, fungi, yeast, protozoa? So that's a tremendous help for the body. Imagine putting something in the body that you can't develop resistance to. It's helping you generate energy, it's helping you deliver oxygen to all the tissues, and it's killing the microorganisms. So it's a real boost to the immune system. I mean, I can go on and on and on, but those are the main things.
Okay, so we're stopping here.
Okay.
Can you put it back on? Because the thing went off.
Oh,
I don't know where.
Okay.
Stop?
Okay, yeah.
No, you could keep it on. We'll just keep it running because I have like 4 hours on there.
Okay.
You don't. I mean, if you want to
Okay.
sit, that's fine. I just need you to push the button when
Okay.
we're done.
Okay.
How long is it?
Oh yeah. How long has it been using medicine? Okay. So, Dr. Bravo, ozone has been around for a long time, and people really don't know much about it. So let's talk about how long it has been around in medicine and what are the different types of ozone.
Okay. Ozone has been around. We have found articles and references back to the 1880s. Okay, ozone was used intravenously. We just found journal articles from University of Michigan where they were injecting ozonated water in and around tumors. It's been used in a lot of different countries, particularly in the European countries, but it's really caught on here in the United States. In the last 100 years it's been used, but I would say in the last 30 years or so, more and more doctors are realizing the value of it. Just because it has not been taught here doesn't mean it hasn't been used all over the world. I mean, it's used in scores of countries, and I don't want to say why it hasn't been used here, but it is catching on.
Well, a lot of people are going to ask that, is why is it not everywhere? Because I heard about it 15 years ago.
Yeah.
And there's so much politics involved at that time.
Yes, there are politics.
And they were trying to get into the hospitals, and they weren't being allowed to get in the hospitals. And it's just like, but it's just ozone. What's the problem, right? So it is an issue. And unfortunately, the whole politics and pharmaceutical industry is blocking a lot of our alternative healing, but yet it works, right? So then there we sit.
Well, if something works, and if it's less expensive than other alternatives, and if it's less toxic, a lot of doctors are turning to it because it's helping people, and it doesn't have to be expensive for it to work. And why not use something that works with the body's physiology? So a lot of doctors are saying, hey, wait a minute, there's something to this. So they're attending workshops, they're being part of societies, and everybody's sharing information. Everybody's saying, well, this is working. Why shouldn't we be using it? So what if we didn't learn it in medical school? It's here, let's learn it now. And so a lot of doctors are being part of big organizations, where they're learning all these special techniques. Let's see, there's all these different ozone societies, but people in ACAN are learning these techniques. There's a lot of societies out there where doctors are saying, let's continue to learn. We can't just go by what we learned in medical school. We have to continue to evolve. And so these things are helping people, so they're gaining popularity.
Yeah, and that's great. And you actually work on athletes on this,
Yes.
and people
Yes, I do.
also with health conditions and people with all kinds of things going on. So it is good for all types of situations. Is that right?
Yes, I mean, it's going to help you if you're healthy. I think it's just people are coming out of the woodwork because they're not finding the answers all the time with pharmaceuticals, and they want to not just cover up symptoms. And I think there is a time and a place for pharmaceuticals, but to really get somebody well, you're going to have to, there's going to have to be shifts in what they're reaching for to eat, and in where they're living, and how they're sleeping, and stress levels, and things that will naturally help rev up the body. I mean, it would be nice if we could really help people evolve to be well and to feel well, rather than only intervene when there's a crisis. Okay, because when there's a crisis, you need to have a certain heart rate, and you need to have a certain blood pressure, and you can't have a fever out of control. And at that point, we have to pull out pharmaceuticals and things at times. But I would much rather work with people before they get to a crisis mode. Okay, so that's where nutritional therapy and ozone therapy and mineral balance, that's where we want to intervene.
So you combine a bunch of things. You don't do just ozone. You
No.
believe that combining a lot of
Yes.
things to feed the mitochondria, and I want you to get into that because not a lot of people talk about like that. That you believe that incorporating all those other
Yes.
things actually help the person 1,000 times more.
Yes. We always do a thorough history taking, and we do a physical exam, and we try to assess everything possible that we can do to help that person heal themselves. Ozone is going to help most everybody. There's rare situations where it won't. But I like to look at people's mineral balance in their tissues, because if there's a mineral imbalance, they can't bring in those nutrients to combine with the oxygen to make that energy. So we like to do tissue mineral analysis, and we're very big on certain blood tests, because a lot of people are walking around with suboptimal functioning thyroids. And thyroids are very important because thyroid hormone in its active form also goes through those little energy furnaces in the cell and turns up the heat to help people accomplish what they need to. When you're sick, your mitochondria need to kick into high gear. Ozone will help them do that, but having the right amount of thyroid hormone and body's ability to respond to thyroid hormone is very, very important. So all of this is acting on those little energy furnaces called the mitochondria. So anything I can do to bring what the, to the mitochondria, what it needs to function properly is going to help them get well. So ozone, honestly, in a way, it's its own therapy. It's like a panacea. But if I can tweak the body with nutrition, if I can tweak the body with hormone therapy, all of that is going to help the person get well faster.
Can you share with us a story of somebody that you work with who has either issues with their thyroid or pain or whatever, that you've seen the difference dramatically or in long run of how once they started with the ozone, they came in with an issue, but then with your protocol that they saw that big a difference?
We see people who have been plodding along for years, and they've tried one thing, they've tried another thing, they've tried all kinds of different nutritional plans, but I think I can think of several examples where they finally came in and they added the ozone, and it really seemed to be the catalyst to get things going. Because think about it, they're using finally energy properly, and the body can then wake up and correct things. Okay, so I would say that's most everybody. I have a lot of people who come here and they've just been plodding along. They've gone from doctor to doctor, and I really think the ozone just works with all the other things that they're doing. I have a lot of people coming here and they're seeing maybe 2 or 3 other therapists, and but they need the ozone. And it seems to make it's the last little ingredient to help get them going. So.
Okay, hold on one second. So, can you think of somebody specific though? Because that would really help. Testimonials really make a big difference. HIPAA regulations. I can't talk about an individual. Oh, without their permission?
No, absolutely not. I can't do that. If you want, I'll interview.
I can take my back. I couldn't walk for 6 months.
Well, we can.
Yeah, we can do.
I mean, my husband is a great example.
Okay, so we'll do that. How did you get interested? Oh yeah, we talked about that.
Yeah, I lost use of my left leg for about 6 months, 8 months.
Okay, good. So let's do that.
I can give you examples. I mean, I'd be happy. I can't tell you names because
no, we don't need names. No. We just need examples. So think about. Okay, we'll talk about you, and then
we've had miracles. We've had miracles on.
Okay, so that's all we need. Just like a come on, 1 second.
Okay.
Remember the woman with the abdominal pain? You gave her an injection.
Yeah, that's the first person to me. If you want to think about miracles, I mean, where one treatment.
She was on drugs for medicine for the longest time, and then she came to you.
Okay, let's do that. So, because the beginning is always the basics, and we talk about all. Did you want to bring up any other specific therapy?
Well, there's ozone for joint injections. There's ozone for scar therapy.
Okay, so
ear insufflation.
Okay, ready? We're going to talk about that.
Okay, great.
It's still on.
So we also want to talk about the different ways ozone can be used. So why don't you start sharing with us so that people know that you don't just do it one way, which is typically rectal insufflation. Most of us have heard about that.
There's different ways to get ozone into people, and depending on what their needs are, and if they're very toxic, you want to go slow. So some people I'm going to want to do multiple injections in the vein over time. Other people I'm going to want to do larger injections, maybe once or twice a week or once a month, depending on where they are in their healing. But there are people who come to us with joint problems, okay? And so we do direct ozone injection into joints, knees, shoulders.
Do people get immediate relief when they do that?
Often.
Wow.
Often.
Depending, of course, how long they've had it and then the
how
amount of inflammation, sure. But yeah, wow, that's really interesting.
I've had people come in, they couldn't walk on their knee, you give them an injection and they start walking. But sometimes it can take a few injections to get people to heal. I mean, you're trying to incite a healing reaction. It can take time to rebuild something. We try to get people functional. We have people who come in, they had a frozen shoulder for 2 years, and you give them an injection and suddenly they're able to go out and function again. But it will take time to build that joint. We give pelvic injections for ozone, insufflation for women vaginally. That often helps clear up long-standing problems in the pelvis. Ear insufflations, if they have an upper respiratory tract infection, can be very helpful. Also for tinnitus or tinnitus, depending on how you say it, we can do insufflations into the ear, and that will make a big difference. Scars, people who have scars after implants, things are removed from a leg or an arm, and they have these big angry scars that are pulling, and they're very painful, and we will inject all along the scar, and the scar will start to relax. We've used ozone for cosmetic reasons, where you basically put little tiny, it's like mesotherapy, you take a little tiny needle and you make these little tiny injections into the soft tissues, and that will improve the the physiology of those tissues, and they will fluff up and they will start to improve. And so people are doing it for cosmetic reasons in the face and on the neck and other areas.
Wow, I didn't know
So,
about that one.
yeah.
Well, interesting. So
So-
then, you had mentioned that your husband had gone through a journey.
Yes, we can
As you-
talk. Yes, Herman had multiple bulging discs, and then he underwent a sports injury, and he ruptured 2 discs, and I didn't do Ozone many years ago. And he had to wait for his discs to basically, heal, but he never really regained full function on the left side. Is it the left side?
Yeah.
And he always had pain and tingling down the leg. And I gave him 1 set of ozone injections, I swear, because getting your husband to do this, it's easier with patients, not with family members. But we did 1 set of injections, and you have not had any numb tingling sensations ever since.
Great.
Okay.
So that's your husband, and then you had other people that
Sure.
you've seen
Um,
a big difference when they came in.
I have people who come from far away, and you want to give people realistic expectations. You'd be surprised how far people will travel for answers. I had this one young lady, and she was in chronic pain. She couldn't have relations with her husband. She couldn't even go to the bathroom normally. She couldn't urinate. She was always in pain. She couldn't get out of bed in the morning. And she had been on so many courses of antibiotics when she was told that she had, I think, mycoplasma and ureaplasma infection in her urinary tract. And we gave her 1 set of pelvic injections, and I thought it would take 2, possibly 3. And we gave her the insufflation, and she felt much better, and she didn't require any more therapy, and she is fine to this day, and that's like 1.5 years later.
Wow.
So that was amazing. Sometimes we get miracles.
Yeah.
So, but most women, I would say it's going to take about 2 to 3 sets of injections, but it's easy to do, and takes just a few minutes.
Yeah.
Can you
that's
imagine?
really
No
awesome.
more antibiotics.
Yeah.
So pretty good.
And no side effects.
None.
Yeah, that's awesome. Thank you so much for your time. I appreciate it.
You're welcome.
Yeah, and those of you who have questions and want to see this later on, this will be on as a replay for the week, and you're welcome to watch as Dr. Bravo takes us behind the scenes in her office as we do a session on her husband.